Hey folks, Nick the Nurse here. Today we're going to be talking about some of the risk factors and causes for the nursing problem of hyperkalemia, or elevated blood potassium levels. Now, this is super important because as both the former nursing student and as a nursing instructor and certified nurse educator, I can tell you that hyperkalemia is one of the most tested disorders on nursing school exams, and there's a good chance it might even come up on your NCLEX. Why? Because hyperkalemia kills. When a patient has hyperkalemia, it can kill you. So you really need to be familiar with this particular disorder. So let's start. Now with hyperkalemia, risk factors and causes can include renal failure. Why? Because the kidneys are not able to clear the potassium from the blood. That's really important, so remember that. Burns. Patients who have suffered particularly from severe burns are at a greater risk of developing hyperkalemia. Bowel obstruction, certainly a big risk factor for developing hyperkalemia as well. Addison's disease, acidosis, infection, excessive potassium intake. Well, yeah. I have a friend of mine who has a relative who said that they ate I think a dozen bananas per day, and I guess their potassium went up so high that they developed an arrhythmia. So you gotta make sure that you control those potassium levels. Bananas are good for you, but probably not a good idea to eat a dozen of them per day, especially if you weigh about 95 pounds dripping wet. So dehydration, certainly a risk factor or cause of developing hyperkalemia as well. Crushing injuries can certainly be a risk factor, as can potassium-sparing diuretics. That's the classic. All nursing students are expecting to have some type of question on their nursing school exams, or maybe even on their NCLEX, that deals with potassium-sparing diuretics such as aldactone. Because remember, with other diuretics like loop diuretics, Lasix, those can cause potassium depletion. So you won't necessarily see hyperkalemia with a loop diuretic. So lots of good risk factors there. Make sure that you understand those so that you can apply them on your nursing school exams or on the NCLEX. Again, my name is Nick the Nurse. I'd like to thank you for watching this video today. If you'd like to check out any of my other completely free videos, they're all located at www.nickthenurse.com. Again, that's www.nickthenurse.com. Or you can check me out and subscribe to my YouTube at Nick the Nurse. Thanks for watching. I'll see you next time.